Hello, I'm Dr. Vinod Kulkarni, psychiatrist. I'm a legal consultant also, by virtue of I having pursued my LLB course also. What's a professional indemnity? Many people ask me, what is a professional indemnity? It is an insurance plan to financially safeguard we medical practitioners against what? Against legal costs and claims. It's a contract. It's a contractual obligation. One party will compensate for the loss incurred by the aggrieved party. Who is the aggrieved party? Your patients are the aggrieved party. Patients may sue doctors in consumer courts, in consumer redressal forums, etc. At that point of view, doctors may not be in a position to pay the hefty sums as claimed by the patients. Such indemnity insurance plans come into come very handy and come for our help, for our aid in such instances. What do you mean by indemnify? To indemnify means to compensate for a loss. To indemnify means to compensate for a loss. Mark my words, my friends, an error of judgment from a doctor does not tantamount to medical negligence. I may commit some mistakes. My judgment may differ from the judgment of somebody else. An error in judgment will not be declared by a court of law as amounting to medical negligence. What we need to exercise is a standard reasonable care. Standard reasonable care. Our care should be such that even if the patient were to go to our colleague or an equally capable person, the patient would have received the same treatment from that individual also. Standard reasonable care is what the courts look for, is what the courts ask for. There may be a negligence of two types. One, an omission to do, which a reasonable man would do, which a prudent man would do. Another is a commission, committing an offense, which a prudent man would not do. So, either an omission or a commission. Remember three criteria for medical negligence. Number one, we should indulge in standard medical care. Number two, there may be a breach of such care. Number three, such breach should produce the consequent damage to the patients. If these three criteria are being met with, then perhaps the courts may declare that it tantamounts to a medical negligence. In the professional liability insurance, it is also called as indemnity insurance. Both are one and the same. Both are synonymous with each other. Indemnity insurance and professional liability insurance both are same. What all are covered in this insurance, my friends? The things covered are defamation, breach of contract, slander, libel, etc. Apart from, of course, cause for medical negligence. You must remember 304A of IPC, which speaks about death due to medical negligence. Now, of course, BNSS has been evolved, but still 304A IPC, some people use this also, death due to medical negligence. This is something about professional indemnity insurance. There is something what's called as a vicarious responsibility. In forensic medicine or jurisprudence, it's also called as legal medicine. We have an entity what's called as vicarious liability. That means if the employees of the hospital commit some mistake, the employees are not held responsible. I am held responsible. Supposing I want to give ECT, I assign the job to my junior assistant. God forbid something goes wrong, and if some medical catastrophe occurs, the junior who has given ECT will not be held liable for medical negligence. On the contrary, the boss, the employer, the chief, he will be held responsible. It's what's called as vicarious responsibility also. Can we switch from one insurance policy to another? Why not? You can switch from one insurance indemnifying policy company to another, and you can switch to many companies also. And the compensations, the benefits can be claimed not only from one company, but if you have insured uh, in many companies, I think the compensation can be claimed by all the companies also. This is something pertaining to professional indemnity health insurance. Thanks a lot for watching. All the best.